Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Morning.
Chicago is getting ready to enter the next phase. What does that mean, and do you agree with the strategy?
The metrics are going in the right direction. I think the timing, though, is unfortunate in that we've got all these variants floating around in the population now that are going to cause a lot of trouble. I think we have to be very careful. And I mean, I would defer it, but I think there is an argument based on the current metrics to loosen things up a little bit.
400,000 COVID deaths now. Is the CDC to blame at all for this?
Yes.
How
yes.
so?
The CDC has been, I think the comment that I read earlier this morning was they've been benched. They've been put to the side. They should have been in charge of all this guidance and everything, and it ended up coming out of the White House from some non-experts, which has really been very bad. And I know that is going to turn around probably starting this afternoon with Dr. Walensky from Mass General Hospital, who will be taking over the CDC. She's an incredibly competent person who's written about the epidemic and really knows what's going on.
Let's talk about immunity. There's a study that says immune cells remember COVID for 6 months. What does that mean? Is that in regard to immunity?
Yeah, so immunity is more than just antibodies. Immunity is antibodies, memory cells, and other immune cells that remember the virus and can fight the virus. So it's all three things. So antibody levels go down. The reason why we hear so much about antibodies, it's very cheap to measure them. It's easy and inexpensive to measure an antibody. The other tests are much more complicated. So there's a little bit more emphasis on antibodies, but maybe we're emphasizing the wrong thing. So the people that did this study, a very highly credible group with Michelle Husen-Spike at Rockefeller University in New York City. He's basically the king of antibodies and immunity, and he has studied these patients for 6 months and shows that all the antibody levels go down, that memory cells and the other immune responses stay stable. So this is it's very good sign.
All right, let's get to some viewer questions. This person says, why are restrictions being lowered in Illinois while COVID variants are popping up around the country and the world while the vaccine distribution is so slow? It seems counterintuitive, if not stupid to me.
Well, I would use the word counterintuitive. You know, I think this person hit the nail on the head. You know, why would we be loosening things up? Things are going in the right direction. They're still bad. You know, 4,000 new cases a day, this is not good, all right? Don't ever think that that is good. The positivity rate is down below 6%, but it should be 1 or 2%. So, I mean, I think it's premature. I agree with this person, but, you know, I'm not the public health leader in the state or the city, so they're going to do what they want to do.
Next question, do you have any tips for how to help out with second dose reactions? My dad is of a certain age, and whenever he gets a fever, his entire body collapses. I'm nervous about how he will react when he gets his second dose.
Well, he's probably going to react a little bit worse than with the first dose, but, you know, very few people have died from these reactions. And the thing is, if a person gets a very bad reaction and looks sick, take them to the hospital. This person will be at a hospital. Make sure that he's getting his dose at a hospital itself, and keep him around there for at least 30 minutes to see if he just gets through that. Otherwise, you just treat with Tylenol and other kind of usual things just to treat a reaction. These reactions are self-limited, though. They go away after a period of hours or a day.
All right. Next person says, after both vaccinations, once immunity is reached, is it possible for someone to still be a carrier of COVID and pass it on to others?
This is this theory that's going around that after the vaccine, you can be a carrier of virus. I mean, nobody's reported that this has happened, but it keeps popping up in the literature that, yes, you can be a carrier. And, you know, nobody's seen it. It's also very unlikely that this is to occur. If it happens, I'm sure we'll be talking about it, but I'm not worried about that.
All right, Dr. Murphy, thanks for being with us. If you have a question for the doctor, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow at this time. Have a good day.